Today I'm going to be going over bone fractures for my BIO2120 AP2 class. I actually chose this topic because my mom currently has a bone fracture, and also I'm going into the X-ray technician program at Baker College, so I figured this would be the best topic for me to cover. A healthy physiology of a bone is the bone undergoes constant repair. So this is because to maintain the proper nutrients level in the body, the bone needs to break and reform. The bone no longer grows past puberty due to the hardening of the epiphyseal plates at each end of the bone, but the bone undergoes constant reconstruction to maintain, as I said, adequate nutrients level in the body. Osteoblasts are the cells that build the bone and that uses up calcium in the body, and osteoclasts break down bone and releases the calcium. So this constant bone repair and breaking is actually how we keep our calcium levels in the blood at a stable level. The bones are important for protection because it protects, for example, in the thoracic cavity, the heart and the lungs. So that protects it using the ribs and the sternum. Also, erythropoiesis occurs in the bone marrow in the middle of our bones, which creates red blood cells, and storage of nutrients in the bone matrix. So for a fracture, it is most commonly known as a broken bone. It can be caused by stress and traumatic injury. Classifications include transverse, which is when the bone is broken into two pieces. You can have a lateral or straight across kind of transverse break. Complex is the bone breaks out of the skin. The comminuted is a shattered bone. Spiral is when the bone twists and is displaced. Green stick is the bending of the bone, which is most common in children. Avulsion is when the bone and soft tissue are damaged. And a hairline fracture is a crack in the bone. All these bone breaks fall under complex or closed. Closed is when the bone does not break the skin, and complex, as I mentioned before, is when the bone breaks out of the skin. As you see, I have a transverse and linear. We have transverse, which is one of the breaks here, oblique, linear, which is like a hairline, oblique displaced, spiral, green stick, which is the bending, and comminuted, which is the shattering. Risk factors of bone breaks include osteoporosis, which is the most common factor. Lack of vitamin D and calcium can also contribute to that due to calcium in the body needing to break, those osteoclasts need to break down the bone, which makes the bones weaker. And being of older age and no longer growing also causes the weakening of bones. Fractures also occur again due to trauma, so any sort of trauma can also be a risk factor. Symptoms include pain at the affected area. That is typically due to the swelling and inflammation of the bone healing. Trouble using surrounding joints due to that swelling and inflammation. Swelling and the warmth, bruising, and redness. Diagnosis of a broken bone. You will use X-rays, which are electromagnetic energy rays used to form an image of bone and other hard tissue. MRIs are magnetic resonance imaging using magnets and radio frequencies to create a detailed picture of the body. An MRI can typically capture also a lot of the dense tissue, not just the bones. So if it is a avulsion, then you can picture both the broken bone and the torn ligaments or torn muscles. CT scan uses X-rays in addition to computers to create a detailed map of the body. So if you don't know exactly where a bone could be broken, if there may be multiple broken bones, a CT scan is typically what is used. Here's a picture of an X-ray of a broken bone here displaced. It looks like that is in the radio-ulnar area of the arm. Casts or splints are typically used as treatment to stabilize the affected area. So casts will wrap around the arm and encase it in a hard mesh. That makes it so your bone is immobile and it has more time to heal and less chance of further injury. A splint will hold the area into place so it's in the best possible place for healing. Some fractures may require surgery depending on the severity. For example, if it's a spiral fracture, it will need to be replaced typically. This can include resetting the bone or installing screws or other hardware to return the joint to its original function. Follow-up care can include different therapies and nutrient intakes. An increase in vitamin D and calcium is advised because they assist in osteoblast activity. For example, my mom is currently taking a lot of vitamin D and calcium vitamins. Physical therapy may be prescribed to exercise the muscles surrounding affected bones and maintain some motion during the healing process so that muscle mass isn't completely lost. Physicians may advise limited activities other than PT, along with non-weight-bearing activities to prevent further injury. Prevention, there's not always a way to prevent broken bones. A lot of times bones are broken in car accidents, which, practicing safe driving is a way to prevent that, but it can't be completely prevented, of course. Preventing falls and eliminating fall risks if you're of older age. Eating right, including calcium and vitamin C in the diet, and exercise to maintain that muscle mass and provide some protection for the bones.